Last April time I wasn't very well at all, and the cancer unit I go to in Harrogate Hospital said that I would benefit from palliative care, and I got the palliative care people from St Gemma's, and that was very lucky as far as I'm concerned, because they looked after me exceedingly well.
We've got a team of 8 clinical nurse specialists who see people in their own home, and as doctors we work alongside them so that if a patient needs a more in-depth assessment by a doctor, or they've got specific questions they'd like to talk to a doctor about, then we've got a team of doctors, senior doctors here, who can see patients either in outpatients, and we run an outpatient clinic 5 days a week at the hospice, or we can see them at home if patients are not well enough to get up to clinic. And we see patients for a range of problems, so that may be physical symptoms such as vomiting or pain. It may be difficult psychological issues related to their illness, so they may have excessive anxiety or depression. It can also be patients who want to think about their future and what treatments they may or may not want in the future. So some patients benefit from coming to talk to a doctor who they may not have seen before, who's not their general practitioner or hospital doctor, to think through some of the treatments that may be available to them that they may want, or treatments that they may not want, so it helps them to plan really for the care they get in the future.
I'm looked after by the nurse Julie and her boss Jason, and when you've been in their company for 10-20 minutes you feel totally uplifted and you feel so much better, but when you come to discuss serious things they switch off and they're totally professional, and they come to see me in my home, or I go to see them at the clinic down at the doctor's in Wetherby. And it's a very valuable service they provide, and I benefit from it immensely.
Ian was very poorly when I initially met him, but now his quality of life has vastly been improved with the symptom support that I've been able to provide, and that's been working with the greater team at the hospice and working with the GPs and the district nurses in the community. And now, and that makes me feel really good that we've got it right.
The meds I'm on now, they're cracking, they're really doing everything you want them to do.
My role's not just to support the patient in the community, but I also provide support to their families and carers as well. And it's not just managing the physical symptoms, it's providing psychological support and spiritual support as well to both the patient and their families.
It's certainly changed my life. For the better, probably saved my life. I put it as strong as that.
I enjoy my role because it means that I can keep a patient at home and nurse them within the home environment, which is where they want to be and also where their family wants them to be, and that enables the patient to have a more fulfilling life keeping at home.